This
Is journal.
club. So, adverse childhood experiences and subsequent chronic diseases among middle-aged or older adults in China, and associations with demographic and socioeconomic characteristics. I'm Kevin.
I'm Kevin.
I'm Isabel.
I'm Sienna.
So let's begin. What are adverse childhood experiences? Adverse childhood experiences, or ACEs, refer to a wide range of potentially stressful experiences that occur in childhood. And the first correlation between ACEs and chronic illnesses was uncovered in 1990, which is what this study is focusing on. Let me ask you guys this. How many of you have friends that have either divorced parents or parents that have died, siblings that have died, friends that have died? I know recently there's been some problems with mental health in high schools near our area.
Hmm.
For
Yeah, no,
sure.
it's very prevalent, especially things like divorced parents or even like use at home. Like I've noticed it a lot.
Yeah, and these issues in and of themselves are already like having parents that are divorced, that's already a great enough issue as it is. But the thing that the study uncovered is that this can actually lead to chronic illnesses in the future, which is what we'll be discussing today. And another significance of this is that ACEs are highly relevant in pediatric clinical settings. Isabel, you have a sister that works in pediatrics right now, right?
Yeah, I do. And she brought it up to me. She was like, "Oh, you guys should cover ACEs. This is something that's really important that, is coming up a lot in healthcare, especially in kids." You know?
Yeah.
So,
Okay, so going into the study itself, the data was collected through the China Health and Retirement Longitudinal Study, or CHARLS, which was a longitudinal survey of residents aged above 45. And the ACs covered were, as mentioned before, physical abuse, emotional neglect, household drug use, domestic violence. I'm not going to list them all, but you get the idea. Unsafe neighborhood, parental divorce, parental death, parental disability, and
bullying.
it was actually found that they were associated with chronic illnesses such as hypertension, dyslipidemia, diabetes, digestive disease, even Alzheimer's. And
Mhm.
the way that they actually analyzed the correlation between ACEs and chronic diseases was using a simple logistic regression model. And one thing that really stood out to me was that I know Kevin and Isabel, you guys both take AP research right now, right?
Yeah.
And the thing with AP research is that it's hard for high schoolers to find an original research idea and actually implement that for their class. So a lot of people end up doing either like literature reviews or like survey studies. And
Yeah.
this study was exactly that. It was a survey study. And I'm gathering the data from the survey and actually getting results from that using a simple logistic regression model. Like in this day and age, you can literally just go on ChatGPT, give it your input variables, say you want to find the correlation between them, it gives you the code and that's it. And it really shows how easy research is to access for high schoolers if you just have the right idea and you go about it the right way.
Yeah, I wonder how easy it is to access just for like students or just like regular people to access like this database or something similar.
Yeah, I mean, there are all these public databases like for bioinformatics data, like GEO, or
Mhm.
like Kaggle for machine learning databases. And it really, I think the study really highlights that um, how easy it is for high schoolers to actually get into research. And it kind of makes me wonder like why people aren't doing it more, you know?
Hmm.
Wait, so this data set, was it like this survey, was it conducted especially just for the study, or was it something that was already done before?
No, so this survey, I'm pretty sure was like like kind of like a census report, but
Okay.
uh yeah, so it's secondary data. These researchers, they found this online survey for like so many participants in China and just picked up the data that they wanted
Uh-huh.
and applied the regression model to that and found some really interesting results.
Uh-huh.
Yeah, this figure is basically a visual representation of the methods that they used, and it just kind of just shows for AP research students the problems you might face when going about a survey study. So you might have to exclude people that don't fill in data for the survey for no apparent reason. If it's a longitudinal study, maybe they don't follow up. maybe they're just the wrong cohort. Like you say, do you want 45-year-olds to fill this out, and you get some like 10-year-old kid. Some people just don't tell you what they have, what kind of diseases you have, and you just filter out those missing data, and it just makes analyzing it a whole lot easier.
Because this study was done like primarily in China, right? Do you think that the results would vary based on which like population you choose, or do you think it's across
Yeah, I think that's a
everyone?
really big issue in research right now, is that most studies are being done are specific to a certain cohort or group of people. Like and not just in people. We'll talk about people first. Like different ethnicities, they have different like like people from the African subcontinent are more resistant to like, what is it? Some
From disease?
Oh
I'm
yeah,
sorry.
something else.
Yeah, there's something like that, and then they're like maybe white people are more susceptible to hypertension or something like that. There are all these variabilities in ethnicities,
Mhm.
and it really just makes generalizing studies more difficult. So, yeah, being done in a Chinese subpopulation, I think we can't generalize it to.
Well, I mean, you don't have to generalize it to like people over 45 in the whole world, but you could recreate it in different
Right,
populations and see
yeah.
how that affects like in those smaller groups.
Yeah. And I do think it will be replicated because we'll discuss later, but a lot of the confounding factors in the study were actually accounted for, and ACEs were still highly associated with chronic illnesses. But we'll get more into that.
Yeah,
Isabel, you want to talk more about the results?
I got you. So, after, they got all the data and applied the regression model, they found that for people who had four or more ACEs, so like, the ones that we listed earlier, if they had four or more ACEs, that was highly associated with developing these chronic diseases like dyslipidemia, chronic lung disease, asthma, liver disease, digestive disease, kidney disease, arthritis, etc. So actually, it was highly correlated with every chronic illness that I'm not gonna say tested it for, except for cancer, which is really interesting. Another significant result that they found is that 11 out of 12 of the ACEs, so all the ones we listed earlier, except for having a family member in prison, was associated with multimorbidity. And multimorbidity is where you develop two or more of said chronic diseases, so like hypertension in addition to kidney disease, right? So the
Yeah.
study not only reveals that, of course, ACEs are super traumatic for a kid when it happens, but it has really bad consequences later down the line.
And
Yeah.
also with the consequences, like you don't just have to like live with the disease and be in like pain or discomfort, but you also have to pay for it. I mean, with diabetes, you might have to buy insulin. You clearly have to go to the doctor a lot more. And then that can be a burden when you go into like retirement homes for your kids. So it's like all of these like effects are
Yeah,
insane.
that's why this is such a big issue in pediatrics right now. And two other main takeaways that I got from these results are that usually when you think of ACEs, of course we don't associate it with chronic illnesses,
Mhm.
but like it's not simply like you get your parents divorced as a kid and then you're like mentally scarred slightly, and it might affect your psychology maybe slightly in the future, maybe make you less receptive to your surroundings. But it's more like these actually highly prevalent diseases that can like that have a severe detriment to your life. Like if your parents divorced as a kid, you have a higher prevalence of asthma, liver disease, arth Alzheimer's as a as an older adult, and these are really um prevalent diseases in today's society and in association that we don't normally make. But also, one another thing about the results is that we must note that cancer was not significantly associated with ACEs. And the reason I think that is that cancer is more of a it's more variable, it's more of a biological slash genetic thing. And a lot of these diseases, we'll get into more into it later, but ACEs cause stress, and high stress levels actually cause these chronic illnesses. And cancer is just one of those that are in a separate category.
Yeah, I found it interesting how something that could have happened to someone as a kid still carries on throughout their entire life. Because I would have thought that if something happens as a kid, maybe you're being abused, your parents get divorced. I would have thought that maybe that kind of subsides over time as you grow up, mature, things like that. But it's interesting to see how even something that happened so long ago can still carry on these adverse effects, decades later.
Yeah, that's a good point.
I have a question, actually. Do you
Yeah.
think that it's like primarily like a direct relation, like you're traumatized and then when you're older, like you have a drinking problem and then you get kidney disease or liver disease? Or do you think it's like they have an eating problem and then they get diabetes? Or do you think it's really just stress and then
Right.
these
That's yeah.
body's so taxed?
Right.
We go into a few possible explanations of this later, but yes, I think that is a pretty valid argument to why these ACEs actually lead to higher prevalence of chronic illnesses. Like I hadn't thought of that before. Maybe these just influence behavioral changes that change their chronic illness in the future. Okay.
Fascinating.
Okay.
Anyways, this is just a graphical representation of everything we were discussing before.
Mhm.
OR in this part right here, odds ratio, a higher odds ratio basically means higher prevalence
More
of developing
correlated.
multimorbidity. And you can see like literally all of these, if you have these ACEs, you have a higher prevalence of multimorbidity.
Mhm.
But there are a few discrepancies in the data, like incarcerated household member, for some reason has a wide range and the median is actually lower, and parental separation or divorce. One takeaway that I can take from this divorce, the wide range of divorce results here is that divorces are not always bad. Like sometimes they're healthy divorces, and sometimes they're divorces where your parents yell and scream at each other, like try to
Yeah.
steal you from each other.
Yeah.
But there are also these
Go
healthier,
for
like,
being
oh, now you
incarcerated.
have two parents, separate families supporting your journey through life. And yeah, that might be one of the explanations for this discrepancy in the data.
Another
This,
interesting thing. Oh, sorry, you wanted to talk?
I was just gonna say this. Maybe the same thing could apply for the incarcerated like household members. Not always a bad thing to have. Maybe you have an abusive parent who went to jail.
True, yeah. That's true.
Yeah. I was gonna say something I liked about this graph is that like the caption below says that this model was actually adjusted for, age, sex, ethnicity, marital status, like all of these socioeconomic characteristics, right? And even with adjusting for these characteristics, like you can still see that there's a clear association of these ACEs with the multimorbidity. So it's like it helps you draw the conclusion that all these socioeconomic factors, like regardless, there's a clear connection between the ACEs and multimorbidity. So, like, even if you're in a super rich family and you can like afford, I don't know, therapy and stuff after getting beat at home, you're still um more at risk of developing like multimorbidity compared to like, I don't know, a low income family, right?
Yeah, that was really one of the main significance points in this study. Like if you're a high schooler right now and you're taking AP stats, you know that when you're trying to find the correlation between two variables, there's not necessarily a causal relationship between them because there might be a confounding variable that's affecting those factors. And the study really takes into account those confounding factors and tries to minimize them. And as Isabel said before, like no matter if your parents are making 500K a year or if they're making 10K a year, if you're getting abused as a kid, you are going to have a higher prevalence of multimorbidity in your future.
Mhm.
This is just another more clear graphical representation of what we're talking about. Just ACEs on the bottom, as you can see clearly, more ACEs, higher prevalence of multimorbidity. Yeah, okay, so a few possible explanations. I think we were talking about this before, but the main thing that we think are actually causing these chronic illnesses is stress. So basically, your parents are drinking, your parents do drugs, your parents are divorced. It causes stress in an already stressed high schooler's life. So we know the biological effects of stress on on the human body. So prolonged stress can lead to chronic activation of the HPA axis, and dysregulate your endocrine system, your neurological, your nervous system, and even your immune system.
Yeah.
But also behavioral problems, I think Sienna mentioned, could behavioral problems as a kid, if you're a real troublemaker, because of these ACEs, it could impair development of some brain region and again make you less responsive or more responsive to certain factors.
Mhm. Okay, and getting back to one of the points I think we brought up earlier on the graph. So socioeconomic factors like your age, sex, education level, like how much money your household is making, it does not impact like the correlation between ACEs and multimorbidity or any of the chronic illnesses to a great extent, right? And another, I think, really important implication and like so what of this study is that in healthcare, of course, we're always looking towards preventative medicine. Like, what can we do early on to stop a disease or disorder from ever developing later in the future down the line, right? And I think the study provides some great insight into how, like, why we might see like a high prevalence of obesity these days, or, like other chronic illnesses. And this can help decrease the burden on like our future patients and healthcare workers as we keep moving towards like stopping the root issue, right?
Yeah. And again, we really want to stress that preventative methods are just so much better than treatment in healthcare. So, like, I don't know, Kevin, if you're gonna be a doctor in the future, would you rather treat someone with stage 4 leukemia or just prevent them from getting in the first place?
Yeah,
Obviously, preventing them from getting in the first place saves so much money, so much time, so much stress from the patients. And it overall just decreases the burden on patients and healthcare workers overall. So if we can actually minimize these ACEs as a child, knowing that these can influence chronic diseases, chronic illnesses in the future, it's more of a preventative method, going more than just, oh, we need to save these kids from being abused. There's so many more benefits from doing so.
But then how would you go
I
about
think,
like
yeah, I was gonna say the same
preventing that?
thing.
Like things like divorce is like it's really like it's not out, it's not in your
I guess, yeah, that's true, but I
I think
think,
it helps because like earlier we discussed the biological connection. Like so when like we're validating ACEs as like a biological, like there's a
uh-huh.
how do I like causal, right? So we can look more into the biology side of things maybe, or like Sienna said earlier, like the behavior side and
Mhm.
stop things
yeah.
early.
And preventing ACEs, not just divorce. I mean, childhood abuse, you have parents who do drugs. I mean, expanding opportunities for foster homes or just like child protective services would. You might not think it, but it's helping healthcare workers and improving quality of life for everyone.
Uh-huh.
The thing that I think sucks is a lot of these like systems are in place, and I think a lot like for a while people have been trying to like help children who are in such horrible like situations, but I feel like I don't know, society is very good at suppressing problems and they're trying to pretend like everything's fine, but I think like you don't have to help by being someone who has a foster home, right? But you can donate money and you can do other things that will further like that cause.
Yeah. Oh, Sienna, we were driving the other day and then okay, so let's just tell like a story. So there was outside of this boba place in River Oaks, there was this guy, he was preaching to everyone who walked by about like, oh,
The
donate these
backpacks and
backpacks,
stuff.
donate money for these kids in need so you can get them to foster care or get them the resources that they need. And it's amazing that he's doing that because he's like unofficially a member, unofficially a healthcare worker. But going past that, we talked to him about this article actually. We were like, oh, did you know that ACEs are actually associated with higher prevalence of multimorbidity in the future? And he was like, no. So I think spreading awareness that childhood abuse is not just like I think as Kevin mentioned before, like it's shocking that these experiences can actually affect a person so far in the future.
Uh-huh.
And
That
maybe their kids too, because a lot of
yeah,
these can turn
exactly.
into genetic issues.
Right.
Yeah.
And then like they get some of their parents' traits and like abuse their
Yeah,
kids
Yeah, like
yeah, that's great.
generational trauma.
There's no abuse. But yeah, anyways, I think it's good to spread awareness about these issues, which is again another preventative method.
And
True.
now in the 21st century, like it's easier than ever. Social media, YouTube, like
Yeah.
everything. And
Right.
people need to spend more time paying attention to the important things.
Okay, make sure to like, comment, and subscribe.
If you haven't subscribed already, make sure to drop a follow, smash that like button, and
Leave
don't
a
forget,
comment down below if you have
leave a
anything to
Yeah.
comment
add.
down below, leave ideas for our next paper.